Age-related macular degeneration is a disease that gradually destroys sharp central vision. The Healthy Vision Institute is leading the way in treating and, more importantly, preventing both wet and dry macular degeneration. And now we're giving you a simple yet powerful tool to enjoying the sight you have for years to come. Introducing the EVOA AREDS2 eye vitamins, the complete formula for maximum eye health. There was a study done by the National Eye Institute, a division of the federal government, called the Age-Related Eye Disease Study, or AREDS.
AREDS1 was a group of vitamins and antioxidants that enabled a patient to reduce their risk by 25% of going from dry macular degeneration to wet macular degeneration. So it's a big deal.
They utilized 300 retina specialists across the United States and studied approximately 5,000 patients with macular degeneration over a 10-year period. They studied different combinations, quantities, and variations of antioxidants and zinc, and found the exact AREDS1 formula to get the best results, which reduced the advancement of macular degeneration by 25%, and thus reduced the advancement of vision loss by 25%. The concern with the AREDS1 formula is that it contains over 28,000 international units of vitamin A as beta-carotene, which is approximately 5.5 times the recommended daily allowance. Most physicians don't want their patients taking 5.5 times the recommended daily allowance of any supplement. So the National Eye Institute initiated a second study, which is the AREDS2 study. In the AREDS2 study, the high levels of beta-carotene were replaced with lutein and zeaxanthin carotenoids found naturally in the pigment of the retina, and added omega-3 fish oil.
So it's important to understand that having the exact right formula makes a big difference in the result. A little variation can completely ruin the results.
Your physician feels it's important that you know that when they change the ratio or quantity of ingredients or added or deleted some of the ingredients, the effect of slowing macular degeneration was significantly reduced or eliminated altogether. There are a lot of eye vitamins available, but unless they are the AREDS1 or AREDS2 formula, they have not been tested and do not claim to slow the advancement of macular degeneration. If you have wet macular degeneration, it began as dry macular degeneration. So even though your wet macular degeneration and associated vision loss can be treated, the dry macular degeneration is the underlying disease which is still progressing and needs to be slowed as much as possible. Why should you take the EVOA AREDS2 formula? Your physician wants to make sure you're getting the best formula to slow your macular degeneration, which is the AREDS2 formula, and that you are compliant in taking them every day. The EVOA AREDS2 eye vitamins are shipped to you each month in a blister pack, labeled for each day of the month to facilitate compliance. In addition, your physician receives a quarterly report on your compliance, which helps the overall management of your disease. EVOA offers a clinically trained staff, including registered nurses, who can answer all your clinical questions, reducing your risk of age-related macular degeneration or slowing its effects if you have it, part of the ongoing mission of the Healthy Vision Institute.